and the promotion of safe sexual practices. By addressing the underlying factors that contribute to the transmission of HIV and AIDS, such as gender inequality and violence, we can make significant progress in reducing the new infections. Teen pregnancy is another challenge that demands our immediate attention. It is the most obvious indicator of GBV within our community. It not only robs the young girls of their childhood and educational opportunities, but also perpetuates a cycle of poverty and limited prospects. By providing comprehensive sexual education, access to reproductive health services, and empowering young girls to make informed choices, we can effectively prevent teen pregnancy and create a brighter future for our youth. Distinguished guests, as a champion, I am happy to inform you of my program to identify and support teen mothers from the entire county dubbed A Helping Hand to Teen Mothers in Kakamega County. This program aims at rehabilitating and reintegrating teen mothers into mainstream institutions. Our aim as a county is to reduce prevalence of teen pregnancies and where it has happened to rehabilitate the teen mother. I'm glad that there is some slight drop in adolescent pregnancies in the county from 16,969 in 2016 to 12,057 in 2022, and right now we are around 10,000. I am optimistic that with further interventions, this number will come down by the end of the year. In addition to these key focus areas, it is important to acknowledge and appreciate the efforts of our county government in implementing GBV prevention strategies. These strategies include establishment of safe centers, crisis centers, and helplines where survivors of violence can seek refuge and support. Moreover, training programs for law enforcement agencies, health professionals, and community leaders are vital in ensuring a coordinated response to GBV. Ladies and gentlemen, as we address GBV, we still face challenges that include the following. 1. Societal norms and gender stereotypes associated with deep-rooted societal norms and traditional gender roles that increase the cycle of violence and hinder efforts to address GBV. Lack of awareness by many of our people who may not fully understand the different forms of GBV or recognize the signs and consequences. Therefore, raising awareness and providing education is essential. 3. Stigma and fear by survivors of GBV who often face stigma, shame, and fear of retaliation, which can discourage them from seeking help or reporting incidents. 4. Weak legal framework and implementation due to inadequate laws, insufficient resources, and limited enforcement mechanisms that hinder the effective prosecution of GBV cases. 5. Limited access to support services, since many communities lack adequate support services such as shelter, counseling, medical care, legal assistance, which are crucial for survivors of GBV. Therefore, I urge the Department of Health Services and Social Services, together with our partners, to collaborate in sensitizing the communities on GBV and how to respond to the same. Ladies and gentlemen, as I conclude, it is important that the County Government of Kakamega, our partners, and all stakeholders, we commit to do the following actions. 1. To allocate sufficient resources to GBV prevention programs, survivor support services, and capacity building initiatives for service providers and the community. 2. To strengthen the legal framework by ensuring that the SGBV bill is enacted into law, implemented, and enforced, and work towards comprehensive legislation that addresses all forms of GBV. 3. Raise public awareness by conducting campaigns about GBV, its consequences, and available support services. This includes engaging schools, community leaders, and the media. 4. Improve support services by expanding availability of safe spaces, counseling services, medical support, and legal aid for survivors of GBV. In this regard, I appreciate the Department of Social Services for putting up a rescue center in Shinyalu sub-county. We should ensure the rescue center is equipped and fully operational. 5. We should also foster collaborations with civil society organizations, community leaders, and other stakeholders to develop a coordinated and comprehensive approach to addressing GBV. By taking these steps, the county government of Kakamega can contribute to creating a safer and more inclusive society where everyone, including the boy child, is protected from GBV. Together, we can create a society where HIV transmission is minimized, teenage pregnancies are prevented, and GBV becomes a thing of the past. I urge each and every one of us to join hands, raise our voices, commit to creating a future where every individual is treated with dignity, respect, and equality. In conclusion, I want to appreciate our area MP for putting up a safe space at the police station, and we hope that because we have a safe space now at the police station, our people are going to be safe, and the numbers of GBV in Khwisero are going to go down. Thank you all, and may the good Lord bless all of us.